evening and welcome to We the People. India is often described as the surrogacy capital of the world. It's become almost par for the course for couples, heterosexual or same-sex couples from other countries, often the West, coming to India in search of a surrogate mother. Now, surrogate mothers may be as old as mythology itself when it comes to India, but many other people are saying that this remains a vastly unregulated sector. At the heart of the debate is a basic question. When you rent out a womb, when you outsource pregnancy, are you exploiting poor women? But on We the People today, we look at the philosophical questions raised by a culture that we're calling rent a womb. Dr. Anoop Gupta is a preeminent practitioner in this area. What do you say to the critics who again say that in effect in India, when it comes to surrogate mothers, especially those picked by those who come from outside India, it's often poor women and it's women who are doing it for money. Now, one way of looking at it is, so what? So what? I mean, it's the woman's choice. The other way of looking at it is, this is exploitative because it is like commodifying not just the woman's body and her rights, but also the entire process of motherhood.
To begin with, it is basically helping a couple, who are somehow, like Madam said, unable to conceive or unable to carry their pregnancy. And now we are talking about Indian patients. Indian surrogacy has been prevailing over years now. But now scientific achievement has come where you can genetically parent a child.
You can create a child in a petri dish, actually.
No, but you can have the child in the petri dish only for 2 to 5 days. Not for 9 months. So you need a place to have a child for 9 months, and then only you can have a privilege to have a child of your own, genetically your own child, where you can see your image in the child.
So you see no ethical issues raised by this?
No, there are ethical issues. See, what was prevailing in India was, if you are childless, you adopt a child within the family, or you adopt from the, from the adoption agencies. But now the changes have come. Scientifically you can have your own child, and by taking somebody's help, who is already a mother, and she knowingly does it, and she knows that she is helping a couple who are,
So you're saying what's wrong with it? Renuka Chaudhary, you're a mom, but you've also been a minister in the key ministry when the first talk began about actually regulating this sector. What do you believe was the most disturbing aspect to you as a politician and somebody in this ministry that you felt the need to regulate it?
Mainly because, if you leave the romance of having a child aside.
This pleasure and the pain and this thing.
When you leave all that and when you see...
Thank God somebody has said that.
No, that's the real world. That after you finish, I love babies, but then at teenage time, I thought I should bring a law that says parents can be opiated till adolescence is past. It should be legally done.